One of the frustrating problems that I see, both as a surgeon and especially for the patient, is to see a failure of a hernia repair or a recurrence of the hernia. With hernias in the middle of the abdominal wall, ventral hernias, umbilical hernias, incisional hernias, that rate in some patients may be about 30 to 50%, meaning that they come back again in the future. With groin hernias, an inguinal hernia, that recurrence rate may be about 2%. Typically, when I see a patient with this problem, I'll try and fix it with a different technique. So if you had something done as an open repair in the past with a big incision, I'll try to do it laparoscopically with a smaller incision. Things that can improve the success of a second operation are making sure that you have good nutrition, stop smoking, losing weight. These are all things that can help make a second or a third or a fourth hernia repair successful.